Welcome to the Living Chronic Special Series, Military, Medicine, and the Mission Left Behind. In this powerful series, we're taking a hard, unflinching look at the cracks in the systems meant to care for those who serve. We'll examine the deep cuts to the military health system and how they're impacting service members, retirees, and military families. We'll talk about the VA, what's working, what's not, and the looming threats of cuts and privatization. We'll tackle the tough topics others often avoid: suicide, PTSD, gaps in care, and the devastating ways veterans and families are being left behind. You'll hear real stories, learn how to advocate for yourself and your loved ones, and understand the unique challenges faced by military and veteran communities. Our mission is simple: shine a light, spark change, and fight for the care and dignity our service members and their families have earned. We'll return to our regular Living Chronic content soon, but right now, if you've served or if you know someone who has, please share this series. Together, we can push for real change and make a real difference in the lives of those who've sacrificed so much. Welcome back to Living Chronic. This is Brandy Shantz, and I'm here with Helen Perry, and today we're going to be talking about Veterans Affairs community care. For those of you who are unfamiliar, community care is the outside of the VA health care that you can receive. You get a referral, they send you out to the community, whatever that might be, and you see a doctor, healthcare professional. It could be, there's a pretty long list of actually professionals who do community care with the Veterans Affairs Administration. I've used it myself, but of course there are some drawbacks. There are some issues that we're currently seeing right now, and this is where the VA seems to be headed. When we talk about privatization, we're talking about sending veterans out to the community. So this is a big topic right now. I'm glad we're tackling this one because we really need to do our best to explore every hidden and even visible issue associated with privatization of VA care because it affects us the most. So thank you again, Helen. Welcome back. Glad we're going to be talking about this one today. This is important to so many veterans and their families, and you know this better than anybody. So let's talk community care. What is it, and why is this important?
Yeah, so, first, I am not a community care expert. It is, as with everything, it is a complex system that exists within the VA. And the other thing is that different VAs in different regions operate it differently. And so what may be true for somebody in Texas ends up not being the same for somebody in California or somebody in Washington State or wherever. But what I do is a lot of advocacy with people who are using community care or experiencing problems with community care or within the VA and vice versa and back and forth. And, I think right now the slogan that I keep seeing repeated is that, community care is VA care. And I kind of disagree with that. There's been a lot of opinion pieces that you can go out and read from people who are far more educated than I am that talk about why that's probably not accurate. But it's, community care is a great opportunity for veterans, especially in rural areas who are not near a VA, who need access to some service that the VA doesn't offer. Or maybe they have the service, but it's not, they're backlogged, or they don't have enough providers, or they don't offer like the specific treatment. If you need, for example, I think the example people are most familiar with is like needing a colonoscopy, and they have a gastroenterologist at the VA, but they can't get you in for a year, but you need your colonoscopy now. And so they refer people out, or orthopedics is another one. The challenges that we're having, everybody keeps talking about, it's funny because we've seen this shift. So, in 2024, in January of 2024, there were articles coming out that were talking about, the challenges of the Veterans Community Care Program, the VCCP, and, what it was costing. Like, for example, in 2014, it was costing about $8 billion, and then in 2024, it was costing about $31 billion. And that was about a third of the budget for veteran medical services, which is crazy. And there's all this outsourcing, it's kind of outsourcing, right? Like if you're taking care from within the VA and sending it out, then that's an outsource. The problem is that community care does not necessarily mean that you get seen quicker. Doesn't mean that you get seen by somebody who's more qualified. But now we're seeing like this variety of challenges in that people who have been in community care for a very long time are now having their referrals canceled for no reason, and they can't explain it. Everybody reads the headline and says, well, the current administration has just expanded community care. And then my response would be, that's amazing. I hope that comes to fruition. But what I've seen as an advocate is that people can't access it anymore, that their referrals are being canceled, that the actual reality of how it's being implemented is changing. And whether that's because the VA is short-staffed and so they can't process the referrals, or because it's a financial thing and the pot of money that they're using is decreasing, however you look at it, because we as advocates don't always get an answer to that question of why something happened. What I am seeing as an advocate is that people are coming to me and saying, hey, I've been using community care referrals for the last 3 years, 5 years, whatever, and suddenly I can't go anymore. They're forcing me back to the VA. But I'm in the middle of a procedure, I'm in the middle of treatment, I'm in the middle of X, Y, and Z. And now they're having to take extra steps to fix those referrals. The other thing that I'm seeing from a lot of people is they're getting bills. They'll get referred to a community care referral for some, provider for something. They'll get treatment as that community care provider has deemed appropriate. And then the VA is calling them and saying, hey, we're not going to cover this referral because we, authorized X, Y, and Z. They did A, B, and C, and now you're going to have to pay the deficit and you're going to have to pay this additional amount. And a prime example of this is I have a friend that I'm working with. She gets her care through the VA. She recently had a fall and she landed on her arm. And after she fell, she was having wrist pain specifically. And so the VA referred her out to an orthopedic surgeon to be seen for her wrist pain. And as a good orthopedic surgeon does, they x-rayed the joint that was injured and one joint above, because that is like a gold standard in joint injury. Always the injured and one above. And the other thing with wrists is that a common cause of wrist pain is elbow injuries. If you think about tennis elbow is pain in the wrist, but it's caused by the elbow. So that's just like some medical, that's pertinent to the story. So when she was seen by this orthopedic surgeon, they x-rayed the elbow and found that she had a fracture. And they're like, hey, that's what's causing the wrist pain. Like, yes, it's the wrist, but it's actually the elbow. The VA is now refusing to cover that community care referral because she was referred for the wrist and not the elbow. So she now has to go back through the whole process, explain to them, and now she's running into problems with the VA because they're saying, but you wanted the wrist seen. And she's like, yeah, but it's like a connected thing, right? Like,
Right.
And so that is like a prime example of like what's happening with community care, where it ends up being like a pretty substantial burden on veterans to navigate the policies and procedures, the billing, the follow-up, the referral management. It becomes this like thing that veterans end up having to manage, and it's frustrating. And it adds to sort of this aversion that people have of using VA healthcare. Is it actually better for veterans to get care in their communities if they're having to jump through all these hoops and they're getting these outrageous bills? And by the way, those bills can go to collections, and it doesn't matter that the VA was supposed to pay. The collections come to you. That can, for people who have clearances, that can affect your clearance. That can affect all sorts of things in your personal life. And so it's not necessarily the perfect solution that everybody thinks that it is. Veterans community care is an essential component of VA healthcare. But I think the problem is that now it is being treated as a scapegoat, like a referral system for like instead of fixing the VA problems, we're just like, just refer them out. And the problem is that ultimately is going to come of that is that there's a finite amount of money that funds the community care program. And so if we're using up all of those dollars instead of fixing the problems that we have, then we're not actually we're basically just putting some gum on the flat tire of the car. We're not actually fixing the flat tire. And so it's this nuanced conversation that I have to play with people of like, well, they're like, well, then we should just get rid of community care. And I'm like, no, like we need it. We need it for rural veterans. We need it for veterans who have very complex care. You know, we definitely need it. And there definitely should be choice for veterans. We should also simultaneously be fixing the VA system so that veterans who can get care within a VA healthcare facility, whether it's a clinic or a hospital, can, making sure that it's appropriately staffed, making sure that they have the resources that they need to provide good care. Because I think what you'll find from a lot of veterans is they prefer that because the VA has benefits like we've talked about before. They understand toxic exposures. They understand what your MOS means, you know, like, oh my God, go talk to a civilian doctor and tell them that you worked in air defense. They have no idea what that means. You know?
Oh, well, I am not even kidding you. I had a neurologist. It didn't matter how many times I said to him I was an intelligence officer. I worked as a liaison most of my time in Afghanistan. I was going between the presidential palace, NATO. I was always working with, the different leaders at ISAF. And he could, so like, were you like a truck mechanic? And I'm like,
no.
One more time, intelligence officer.
Yeah.
Not even adjacent to truck mechanic.
But it's a different world, and people don't understand it. They don't understand the rank structures. Right. They don't understand, they don't understand. And so there's a lot of veterans who prefer to get their care and who do get better care within the VA system because they are more, like they're familiar with Gulf War syndrome. They're familiar with burn pits. They're familiar with, some of the unique challenges that come with blast trauma and all of these kinds of things. And so it's, the two things are they're not the same. They're not synonymous. And I think that the problem that we're going to start seeing is, this article from a year ago talks about how Congress was already looking at, how much money the community care program was costing, right? Mm-hmm. And, I think they were looking at like $34 billion to fund community care through like 2026. But again, like, is that money actually going to be there if we're just sending everyone now out to community care? And like, what's going to happen if the money stops being there? Because what'll happen is patients will stop getting seen. They'll say, yeah, you can have a community care referral. We just can't pay your bill. And that's really not going to be helpful for anyone. And like I said, from the advocacy side, what I am seeing is an increase in the number of people who are having their referrals canceled, who are having their referrals unfunded. And for whatever reason, that's just what I'm seeing as advocate. Maybe there's selection bias, right? Because I tend to work with people who, are having challenges and problems accessing care. But I talk to other people as well. And, I've had people tell me like, oh, nope, in community care, it's been working great, no problems. But I have definitely seen an increase in the number of people who are having challenges, with the community care program, getting their bills paid, going to collections, getting their referrals canceled, all these kinds of things. And that's, it's one of those things of like what's being put out in legislation and what's actually happening in reality definitely are not lining up to be the same.
And I should say, Joe Plensler, most people probably don't know his name. He was one of the organizers of the recent Unite for Veterans rally here in Washington, D.C. And he just posted an article yesterday about VA care being under risk because so many doctors and nurses are rejecting working at VA. They're turning down their offers because they just don't view it as a stable job. And that's a problem as well. We do need both. You're correct. And then, of course, when it comes to community care, I didn't realize there were so many issues until I spoke with you. And I probably should have because I've had issues myself. But I've been able to solve my problems by just throwing my hands up in the air and saying charge TRICARE, because I also have TRICARE for retirees. So when things start going south, I call, and I'm just sick of dealing with it. I did that recently with CVS for an urgent care visit that VA sent me out to, but VA wasn't paying it. And I kept getting a bill for like $580 for this urgent care visit. And I finally just called them and said, you know what, just put it on my TRICARE, please.
Yeah.
And then once I got that $80 copay instead of the $580 copay, I went ahead and paid it. So I didn't realize that I was using another different benefit in a situation where many people don't have that, and they're just trying to get somebody else to, the VA who is supposed to pay the $580 bill.
And I don't know if you've ever tried to call VA billing, but it is not.
Oh, no.
It is not an easy thing to get somebody on the phone to talk to them about.
No, again, I would do anything. Just let me at the VA, give me a Lean Six Sigma, a good team, give me some time, because, oh my God.
Yeah, it's painful. And, it's great when veterans, have these backup programs and these backup, if they have TRICARE or they have secondary health insurance or whatever, and they can fall back on that when community care referrals fail. But for a lot of veterans, they don't. They rely solely on the VA programs. And when those programs go to collections, they're ruthless. They don't care that the VA was supposed to pay. They don't care that, the VA just processed the referral incorrectly. And that comes back on you. It can garnish benefits. They can do lots of really nasty things to people that cause them a lot of pain. And, you're just little old you trying to fix a problem. And so it's really important for veterans to be aware of, saving the documents, saving their paperwork that shows the referrals. If they're sending you things in the mail for explanations of benefits or things like that, keep those so that if you end up having problems, you can go back and argue that and fight with them to get them to pay it. But there's simultaneously the problem of now we're losing VA providers. I saw a statistic recently that said in the past, when people would get hired on at the VA, it was about a 10% rate of people who would decline those job offers. Now we're up to 40%. It's a 4-time increase from what it was of people who do not want to work for the VA because they consider it to be unstable or, for whatever reasons they have. I know on the provider side, a lot of providers, we have a healthcare provider shortage in the entire country. For physicians and for nurses and for, other specialists. And so the VA does not pay a lot of money. In the past, the appeal to people was either from the sentimental component of working with veterans, which they felt very attached to, or it was the retirement benefits. But now, as they have whittled away at union benefits and retirement benefits, or there are people who are saying they're not getting paid their benefits when they should have been, all of these things, people are looking at that and saying it's really not, the juice is not worth the squeeze. It's not worth it to us to go into the system that can be very cumbersome and very difficult to work in. And so they're going other places, which leaves these facilities short-staffed, understaffed, under-resourced, and then we rely on more people going to community care to get the things that they need. But again, if the money, the more people that use it, the more money that is going to be required to utilize those resources, which means that we're going to run out of money. I saw another statistic saying that the VA for this year is already requesting a budget supplement because they're over on their costs. Which, if we want to talk about cost savings, there was all sorts of financial cuts that were made that were said that they were going to save money for the VA, but that doesn't seem to be happening.
Right.
In fact, it seems to be costing more money because it turns out when you don't have the right people in the right job to do the work, errors get made, care gets delayed, and all of these things are expensive. I know... I had an appointment yesterday to have one of my knees looked at. It was supposed to be my right knee. The VA had only listed the left knee. I was like, nope, it's definitely the right. I can tell you for sure. The left knee's already been taken care of, but the right knee definitely needs to get looked at. And they're like, sorry, we're only going to look at the left knee because the VA somewhere said only and the way it was written was left knee, comma, right knee, comma, left knee, comma. It was this whole...
Right.
And I'm sure that was never even touched by a human. I'm sure that was probably done by an automated system somewhere that is faulty. And so now the VA is going to have to pay for another appointment when all I wanted to begin with was my right knee to get checked. So all of these things cost money. And, it's really going to start coming down to, I would not be surprised if similarly to how fiscal budgets worked within the Department of Defense. I'm pretty sure everybody can remember, August and September rolling around and everybody's like, we ain't got no money. We ain't got nothing. You can't have printer ink until October,
Yep.
October 10, because that's when the new budget hits. I think that that's what we're going to end up seeing, is that when these programs end up running out of money, that the VA starts to just conveniently losing referrals, misplacing referrals.
Yes.
Referrals don't get placed, and then it's just delays in cares for veterans, and it's really hard hitting on veterans who are rural, who are way out there, who really don't have another choice for care, or who are left commuting 400 miles or whatever
Yes.
to get to a
Yes.
VA just to get access to basic services. And so it's not, it's I think it has been painted as like this cure-all problem, or problem solution for the VA, and it's really just not that.
Right. No, you're right. And, we have these big shortages. So one of the issues I've been having is I have a nervous system condition, right? Okay. So my nervous system's the problem. I can't get in to see any kind of a specialist at VA. They just don't even have them.
Yes.
I mean, they're so short-staffed. The neurologist they did get me in to see was so discombobulated. And there's one of him and a bunch of students that rotate in and out, okay? So one real doctor, bunch of students, and he was so discombobulated trying to get things together that he called me from his own personal cell phone, and then was just horrified when he realized I now have his personal cell phone number. Sorry, doc, but
Yeah.
I'm trying to get a hold of somebody. So they can only send me out to community because there's no specialist at VA who specialize in my condition.
Right.
However, there's also nobody out here who has time to take me.
Yeah. And also because the reimbursement rates for VA community care are
So small.
similarly very low. And so it's very hard if you have a condition. We're in the same boat with my husband's traumatic brain injury. Not only does he require a neurology specialist, but it's like multiple specialists within neurology.
Yes.
So we might see 3 different neurologists who all have different specialties. And, we do use TRICARE for that, because to get it through the VA is like not going to happen.
Forget about it.
Yeah. But on top of that, we have a hard time even with TRICARE finding those providers, because they are very difficult to find. They tend to be very, very specialized. Their patient loads, when you have one guy who, works on CTE or TBI or, balance disorders or movement disorders or whatever it may be, everybody goes to that one guy. People are not dumb. They know that they want to see the specialist who actually knows about and specializes in that thing. And so the wait times are significantly high. The cost to be seen is significantly higher. The offices themselves can be choosy about which patients they take. And so it's barriers in care all around. And that's why you see a lot of people now opting to have and opting to pay cash for these appointments, because so many people just want to be seen. Right?
Yes.
They just want to be seen. They just want to be taken care of. And if they can, they do. And I cannot fault any. We do the same thing with several of our providers. But that is not an option for so many people, which is why it's really important to make sure that our VAs are appropriately staffed and resourced, so that when they need to get care, they have access to equitable health care. And that's where we're really seeing these cuts, having a negative effect on people. I also think that it's very interesting. We just had a VA survey sent to us, and the questions were worded so specifically,
Right.
to really hit at like, oh, things are great, you don't have any problems, right? And it was just very interesting to me that that the way that these questions were worded was done to really kind of allude around any of the issues,
Yes.
But I will say that we have even noticed, the staffing cuts affecting our access to providers, to getting resources, all of those kinds of things. And again, we're blessed in that we have TRICARE, and so we use that predominantly for all of Matt's healthcare, because he is so complicated. But it's community care is it is essential to have, but we also need to make sure that we're doing it in balance with supporting the system itself for everybody else, and that's where I think, we're going to start seeing rationing. I think we're going to start seeing, and we are seeing that, right? Like I'm seeing people who are having, and I would say in the majority of the cases, the rationing that I'm seeing or the cancellation of referrals that I'm seeing are just very poorly thought out. Saying that a provider who, has, like a family practice provider is equivalent to like a women's health provider. And I'm like, no, those are not the same thing. Things. Yeah. And like, yes, family practice may be trained in women's health, but that is not the same. And maybe they have a role in like, there's just all of these different complexities that go into it. And so, I really worry about where we're headed with the community care thing. I think there are big red flags. I see all the headlines that say that, the Secretary of the VA, Doug Collins, is making it easier and he's, facilitating. We only need one referral. We don't need the double provider referral like we had in the past, all these things. But then what I'm seeing on the ground is an increase in barriers to access to care.
Yes.
And I worry about, is this one of those situations where what is happening in the news and what is happening in reality are just not the same thing?
Two very different things.
Yeah.
Well, and I think there's also the quality of life component. So I talk about my own mental health quite a bit. I'm very open about it because I suffer greatly. And it's for various reasons. And when we talk about quality of life, I'm not just talking about the pain I'm in. I'm not just talking about the things that I have lost in my life. I'm talking about my everyday life. So what does that mean? Do I actually have access to some health care? Yes. Is it the best always? No. Do I have to work really hard to get there? Very much yes. Do I have the career I love? No, that's gone. Do I have any, are people willing to help me to find a job? I think so. Maybe I think we have services if I want to just randomly find any other job. But nobody's addressed that aspect. And in those two things alone, there are hours and hours of my day that are taken up with just being the sick person, trying to solve the problems that being sick has hoisted upon me. Just all this stuff that I'm dealing with. And getting the community care referral, trying to get that paid for, realizing it's not going to get paid for, leaning back on my TRICARE to try to pay for something that didn't get paid, finding the person at VA who knows where they are that's supposed to be there to help me find X, Y, and Z. My days are all day long being sick, calling some doctor on some sort of, hold, on doing this extra work to figure out where I'm supposed to go, doing this amount of research. It's a full-time job with unreal amounts of overtime. Yeah. And that's where my quality of life is. So when people ask about veterans and, depression or suicide or any of these things, I think it's very important that we don't just talk about, well, they have access to health care. It's important that we talk about what kind of health care. How easy is it to access it? How much work has to go into getting that health care? How much work has to go into figuring out what health care you need? Are you employing not only your own time, but your family's time to help you find the right specialist because there's nobody at VA to help you? How many hours of your day, week, month go into your own health care? And that's very important to the mental health and well-being of each and every veteran and their family out there, because so many of us are spending all of our free time doing this. And sense of self and mental health is very important. Right now, my sense of self is gone. I'm just a sick person because every day of my life is spent figuring out ways around being sick. We spoke, before we started this episode, we talked a lot about exercise, and people from the outside say, oh, but look, you exercised. You darn right I did. If I don't exercise, I can't move, and then I'm bedridden. Would you prefer me to be bedridden? What am I supposed to do? There are so many
people that would say yes to
my
that.
Day. Yes, but there's so many. I mean, give me a quality of life. There's so many hours of my day just consumed with being this sick person and doing the right kind of physical therapy so I can get out of bed, plus calling the 600 doctors and the insurance company and VA and getting this person on the phone. There are people in this world that just wake up in the morning, go to work, come home, and then have free time. Who are they? What are you doing? I envy you.
I know. I mean,
what's your biggest problem? Do you hate your boss? Wow, I wish I could have that problem.
I mean, I tell people now that, I spend probably, it's increasing every month, I swear, but right now I'm about 30 hours a week of case management for Matt.
Yes.
And that's not including my kids or me or anyone else or anything else that needs to get done. That is 30 hours a week of referral management, medication management, prescription refills, insurance authorizations, check-in, all these kinds of things. And you're right, it's exhausting. And people frequently do not talk about the bureaucratic burden that is placed on veterans and families, very specifically families, because frequently it's not the veteran who takes on that load. It's a caregiver who then has to do it because, similarly in my case, Matt can't. And so, I can remember at one point the VA saying, oh, you need a case manager to deal with this. And I remember a case manager called me and she said, he got injured, it's been like 10 years now, all these kinds of things. She's like, he's not getting better, right? And I was like, you don't say. You're kidding.
Really?
Are you trying to tell me this is my new normal and I need to get used to it? Thank you. Super aware. Also asking for help. And the long and the short of that conversation was they did not help and they are not helping. And so I continue to do everything. But when, I cannot even begin to, and I know it's the same for you, is like the weight that it puts on you of like, I need to call the insurance company, but, to get a hold of TRICARE, I have to call directly at 8 a.m. and make sure I call the one human, I have to make sure that I get the authorization, but where did that authorization go in my email? And I gotta pull it out and print it out. My office has stacks of medical records and referral and medication authorizations and all of these different things. And, oh, you need this authorization. I don't even want to tell you what we had to do to get Matt's CPAP last month. And it's exhausting and it wears on people. And this workload increases with community care because so many veterans are having to manage the referral authorization process from the VA. And I mean, that's a very small part of what many other families, with significant injuries and illnesses have to navigate, but it's exhausting and there's no help. Oh my God. So help me. Nothing. If you have a billing question and you try to get a hold of VA billing or you try to get a hold of a community care billing, like your option is like the patient advocate and hopefully they can get you in touch with the right person. But like literally every answer every problem that happens now in the VA, it's the patient advocate. Call the patient advocate. Call the patient advocate.
Yes.
You have a problem with burial benefits? Call the patient advocate. You have a problem with, accessing healthcare? Patient advocate. You have a problem with medication refill? Patient advocate. You have a problem. I mean, and those poor people.
Everybody.
Those poor people are literally trying to do the best that they can. But like you call a civilian health center and it's like, if you have questions about billing, press 1. And then you talk to Donna in billing. Or you can like navigate through that process. The VA, I have never had luck doing that.
No.
And,
you can't even do simple things with the VA. And it's things add up, right?
Yep.
So this is a cumulative problem. You have all this stuff coming at you and it's cumulative. You can't even just make an appointment online. Now, I did see somewhere that there is a new fancy tool in my va.gov health, the former healthy vet, whatever they're doing. But I tried to make an appointment with my dermatologist because I'm supposed to come in because I have a giant ugly mole that does not look good.
Right.
But right now, the only way to make an appointment with them is they call me. So if I miss that phone call.
Yes.
Oh, well, so now I'm just back there. So I was like, oh, fancy new tool. Let me see. Nope, not for derm. Sorry, guys. Only for primary care. And I didn't try it, but I'd be willing to bet I can't actually get an appointment through primary care. I could be wrong, but.
We have had that problem with scheduling so often because they'll be like, all right, we'll see you back in 6 months. And I'm like, great, like, let me look at my schedule so we can figure out when to get him in. And they're like, no, we'll just call you and assign you an appointment. And I'm like, I got things to do. He's got other providers to see. Like we had 125 appointments last year.
And I can't guarantee you I can answer my phone at all times.
Oh, I know.
One, as you should probably know, I'm kind of sick. So I'm in doctor's appointments a lot and procedures. I can't answer my phone during those times. 2, I'm following directions well. I have a nervous system condition. Turn off all the devices. I do that. I actually do that.
Yeah.
I meditate. I turn off the devices. I'm following directions. You always call me during that time. Stop it.
There is the VA, even for people who, even if you just have routine problems with the VA that they need, this idea that there's not a person that you can call back and just talk to, I think is absurd. I think that we could solve like a solid 40% of the VA's issues if we would actually just start like connecting people to people again. Like a scheduler and, a front office clerk, like with a belly button you can push of like, this is the person who works here. And, like even just for people who have a job. I mean, I don't know about you, but at my job, I can't just like drop everything in the middle of seeing a patient in the emergency department to like answer my phone. Like, oh, excuse me, sir. I realize you're in your own emergency, but like, let me go talk to the VA because I don't know when they'll call
VA's
back.
finally called me.
Yeah. And so it's there's all of these things with it that are just, I feel like there's so much with the VA where like it is a financial fix that needs to happen. It needs to be funded. It needs to be staffed. It needs to be these things. There are so many other things that are just like process improvement. And, it has become this like ultra mega conglomerate system that just like doesn't work for anybody. It doesn't work for the staff. It doesn't work for patients.
No.
It doesn't work for the American people who are like funding these things, and it's I so wish that we could just like, maybe instead of looking at like, I don't know, like whether we're treating, I don't know, maybe instead of like focusing on some of these like, maybe we need to restructure the EMR. Maybe we should just like, fix the phone system. Or here's another one. When Matt was going through the process of getting accepted into the caregiver program, they needed all these records sent. They wanted us to fax these records. We're talking hundreds of pages to the VA. Fax them very specifically. The freaking fax number didn't work. And when you would call, they would say, oh, well, that's because there's only one fax number for the entire system. So you just have to keep trying. So I'm standing at a UPS asking them just to hit send repeatedly, trying to get in on this fax system. Like that's just nonsensical. You're telling me that we don't have like a records upload system. You're telling me that the government didn't just pay millions, if not billions of dollars to have this like EMR system that like, should have allowed the system to like import records. Also, by the way, one of my huge complaints for that system, and this is actually coming out with community care, is that those records are actually not getting sent back to the VA. Right. And so when those records are not getting sent back, it's as if you never got seen. And so they can't close out the referral or see if there's other things that need to get done. So that's like so now again, another burden on a veteran to go and like, make sure you get the note, make sure you get the right note. Because if you don't work in medical care, you might not realize that there's a difference between an appointment summary and the actual clinical note that gets written. Yep. And so there's all of these things that like, again, it just like, they just like keep tossing it onto the veterans and the families of like, here you go.
Yeah, we don't have time. And that's, we've talked about this before on the show. And, the military in general still seems to have this idea as if it's, 1954 and there's this spouse that's there to take care of the home fires while you're, out doing the things. And it just doesn't exist. I have no full-time homemaker to do all this stuff. Yeah. And it just continues on through your time as a veteran, and you have these things that are full-time jobs. They're like, well, don't you just have a family member to do it? Excuse me. Yeah. No, I do not actually have a family member to do this. My husband has a full-time job also. Yeah. Nobody's here to just take care of me. And do you honestly think, even if I did have family to do that, do you really think that it's incumbent upon my family to take away from whatever they're doing in their life to spend every waking moment of their life taking care of me now?
100%. That is what they do expect.
No.
That's what they expect.
It's exactly what they expect.
There's a great book that just came out called Alive Day, written by Carrie Fugit. She was a young wife to a Marine veteran, or a Marine service member who ended up wounded in Iraq, and then he subsequently passed because of his injuries and complications. And in that book, she talks about extensively what it was like to essentially be a spouse thrown into this world of he is now your responsibility. You will take care of him. And the obligation that is put onto families, whether you are capable, qualified, willing, all of these things, I highly recommend that book to anybody who just wants to get a perspective of like what it is like on the flip side of people who come out with injuries and illnesses, because it is very much the expectation of the government that a family member step up to provide total care. And when there is not a family member, I can tell you that it is very ugly. You're talking about people being assigned as wards to the state. Their quality of life is terrible. I mean, it is not a good existence when there is not family involved.
Yeah.
But it is 100% the expectation of the government that these families just magically become sole caregivers.
Yeah.
And it like, I can't even tell, people will talk about, the caregiver program that exists for family members who are doing this, like we're in the caregiver program, we're in the lowest tier. So it supplements us about $1,800 a month, and it's different in the areas that you live, but ours is about $1,800. I'm a nurse practitioner. If I was out working a full-time job, I'd be making $150,000, $175,000, $200,000 in some areas of the country. You can't tell me that is equitable,
right,
or even equal, you know?
Yeah.
And while I am very grateful to have the increased support, it is not, it's not the same.
It's not the same. It's not equitable.
And it's still not meeting all of our needs.
Right. And if we're talking about quality of life, mental health care, wellness, all of these things that we need to be talking about, we are allowed, disabled people, family members, caregivers, we are allowed a comfortable life just like you.
Yes.
We are allowed a comfortable life just like you. You like to get off work and do whatever it is you want to do, relax, switch everything off. You want to just lay on the couch if that's your choice. You want to go for a run. You want to go on vacation. Whatever it is you want to do, we're allowed to do that as well. And this idea that suddenly because you are disabled, all enjoyment should cease to exist.
Yeah.
Just gone. All things that could be fulfilling. I should just be thankful that I have health care and be happy about it.
Yeah.
It's ridiculous.
We have this problem all of the time with people who, they'll see Matt, go out and do an adaptive sports event, or we take a family trip somewhere and they'll say, oh, but he's disabled. Should he really be doing this? And it's like, what do you want me to do? Like put him in a bed and let him die? And I think honestly, that is very much the expectation.
I think that's what they want.
I think it is for a lot of people, and for the VA included. We're very lucky in that we have, some great, support staff with the VA who are very supportive of the fact that I'm still very active with Matt, that I take him out to do things. But there are so many other people who just think that well, if he can go for a walk, he can have a job. And I was like, well, ask him to plan the walk.
Exactly
not samesies there. But it's, it is a huge problem, the judgment. And this comes back to the advocacy and awareness piece that I'm always rah-rahing about, is that I don't really think the American public has some awareness of post-traumatic stress to some degree. And they have some level of awareness about, war wounds and things like that. But I don't think that there is actually a good understanding of what this life is like. And right. I have said so often that I really think that what we need is the pit to do an episode about the complications of veteran care and the burden that is placed on families and what the reality looks like. Because I think if people could see it and really understand it, I think that the approach to veteran benefits, to support resources, to programs like Medicaid and Medicare, to all of these other things, I think it would change, because I think it would really help to open people's eyes about the reality. You know, we've had all of these, you know, sort of stigma, you know, stereotypical pictures created. You know, people watched American Sniper and then thought that they knew everything about veteran suicide and violence and the veteran,
Right.
you know, and I just don't think that it really gives an accurate portrayal of what's happening. I think it's part
Yeah.
of the picture, but it's not all of it. And I think we need
Yep.
so much more of it in order to actually start seeing change. Because I think as it stands, the only thing that people really know are these like stigmatized, you know, sort of, you know, we've created these boxes and like veterans need to fit into these boxes or else it like, you know, it doesn't exist to them. And we just really have not done a
Right.
good job of like, you know, sharing the lived experiences of people and like what that looks like. And it's just, you know, I would love to see somebody include those on the episodes to really give people an idea of like what is going on and, you know, how much work goes back on the families, because I
Yes.
think it's just not, I don't think people really realize, like, I don't think anybody has an idea until you're actually in it.
No, and that's just it. I mean, that's why I try to be as open as I can about my own mental health struggles, my sense of self, because it's just, we cannot emphasize enough how difficult it is when your
Yeah.
entire life, your entire identity is being disabled or
Yeah.
sick. And your entire life as a family member is dedicated to caring for this
Yeah.
disabled and or sick person. It is demoralizing. You know, it's so difficult. I say the same thing to everybody. And again, I just want to be open about it. I'm a member of Dignitas, which is an assisted suicide program in Switzerland. They will take people who are not terminal.
Yeah.
I always keep that as an option. And I want to make it clear the reason is not just my pain that makes my life
Yeah.
not sustainable. It's the way that society deems me that I should have to live with
Yeah.
no enjoyment, no, you know, I'm just this disabled person and I'm constantly living each and every day on a phone trying to fix some billing issue, trying to get that referral,
Yeah.
trying to get that referral to
disheartening.
say the exact thing it's supposed to say. It's exhausting. I can't do it anymore. I'm not sure if I will go there one day or if, you know, maybe I will live out a much longer life, hopefully with the work that so many great people are doing to make veteran care better. Hopefully we can get a better healthcare system. Hopefully we can get a better solution to what we're going
Yeah.
through. But the fact of the matter remains, everybody says they want to do something about, you know, to support the veterans,
Yeah.
support the troops. Well, if you want to do that,
Then do
and let me just take a moment to extend this to everybody. Sick and disabled people in this country deserve a life as well.
Yeah, they do.
We really do.
And it's hard because I think that a lot of people don't realize that, you know, quality of life is more than just a roof over your head.
Yeah.
And right, it is, there's Maslow's hierarchy of needs. It's all encompassing. There's all of these, you know, emotional support, spiritual support, fulfillment, purpose, all of these things. And, you know, I know that especially for Matt, and I think for probably for you and probably for so many other veterans, it's like every year that those things just get whittled away. Mm-hmm. And you can do veteran programs. You can do, you know, we do adaptive sports. We can do things that, you know, give him back a little bit of that sense of connectedness with veterans, all those kinds of things. And then we get criticized for it.
Yes.
You know, and we face scrutiny because we're doing these things. And it's really, I mean, I think that's where, from my perspective, a lot of like I just want to move out into the middle of the woods and tell everybody to, you know, F off. Because I'm so tired of, you know, we've been living in this journey now since 2014, so 11 years. And it gets tiring to have to, you know, and I have no problem telling our story. I have no problem telling people what's happened to him. You know, I frequently have been known to say he got blowed up too many times and, you know, sort of make a joke out of it. Because if I don't laugh about it, I'll cry about it.
Yeah.
But you're right. Like the quality of life people, our whole statement has always been our goal is to thrive, not just survive. But I will honestly tell you in the last 2 years, we've just been surviving. And there are not resources for me as a caregiver. I mean, there's the caregiver program, but like, God forbid that I needed therapy through the VA, because like that would never happen.
Right.
Luckily, I have my own resources and benefits and access to services that I can use for my own well-being, because otherwise it wouldn't happen. My kids, we just got done with the Hidden Helper Summit with the Elizabeth Dole Foundation and Operation Second Chance. And, looking at other military families who are disabled in whatever way, and the impact that has on military children and the children of disabled veterans is huge. And the lack of resources, we've kind of joked that like, Matt could go on 1,000 fishing trips if he wanted to. But if we want resources for our kids, if we want help bringing extra support into the home to help with our kids, and the fact that they don't get access to the same things because their dad is, significantly disabled, that is like not a thing. There are no organizations. The VA does not treat children in the home as uniquely having needs in the event that a veteran is severely disabled. And it's this whole, again, it's this concept of like, everybody wants these veterans to just barely make it. Just barely make it.
Just be alive.
Just
be alive.
And sometimes even then, like the VA is like, cost savings, and it's exhausting. It's exhausting emotionally. It's exhausting physically. In our family, we have 2 very young children. We have started to have some very serious conversations about where do we put our priorities. For the last 2 years, our priorities have been keeping Matt alive. Yes. And that has meant literally hundreds of doctor's appointments, some of which we're waking up at 3 a.m. for. I'm carting kids to a daycare, at 2 a.m, all these kinds of crazy things. But our kids have suffered because of it. And we have started to have this conversation of like, at some point, they have to be a priority. At some point, thriving and quality of life has to be a priority. And if that means that appointments have to get put off, then we're going to have to do that. Because, either the VA has to step up and start providing transportation and a case manager and somebody to accompany to appointments and all these things, or it just has to wait. Because I am one person and my children are little humans and their needs and wants matter. And my needs and wants matter, and Matt's want for quality of life matters. And, I have long said, on the TBI side of the house, it's very much palliative care. They cannot fix his brain. So we need to look at quality of life very seriously and what that looks like. But unfortunately, so many of the policies of the VA are surrounded around compliance. And so if he's, not going to these appointments or getting this blood work, all these kinds of things, then they threaten you with benefits. And so it becomes this punitive system. And it's exhausting. I mean, it's absolutely exhausting. And it's just, again, I really wish we had a better way of telling these stories for people to see in a way that the non-military community could understand it. Because I don't think people just have no idea. They think they know. They watch some TV. They watch some Jack Reacher TV show, and they think they have an understanding of it. And it's the reality is just so much more heartbreaking than I think they could ever comprehend.
No, you're right. And hopefully, we're talking about a lot of issues in this series. Maybe we do another one where we really try to focus in on finding some solutions and putting together some good research around some of these things. Because again, we can't, we need a strong Veterans Affairs healthcare system. We also need the community care. We cannot just leave this up to privatization and only community care. We also cannot defund one or the other. We need these funded and well cared for. So, hopefully if veterans out there have been having issues with community care, this is what's happening. We understand that getting a hold of VA billing is very difficult. And we're all going through it. But again, as we've mentioned in each one of these episodes, please contact your representative in Congress and tell them, we are having issues with our community care. My referrals have been rescinded. I am not getting my care paid for. I cannot afford to pay out of pocket for health care because the VA did not get funded appropriately.
I would say even if your experience is just that you're annoyed with the wait times, write your representative. Yep. They are required to read their mail, whether they do or not, but they are technically legally required to read whatever you send to them. Call your representative. Every elected official on their website has a link that will say, help me with a government entity. You can click on that. You can fill out the information. A caseworker will hopefully call you back. That is technically the official way to get help from your elected officials, is to use their little helplines that they have on all of their websites. You can also use entities like resist.bot, which will let you text it. If you look it up on Google, it'll send a text to your phone, and then you can text it, and it will text out or mail out or email out whatever you want it to say to your elected officials. It makes it really, really easy. They even have like form letters if you want to use those. There's a free version and a paid version. There are lots of different ways that you can reach out to elected officials. But the thing is, and I will say this as an advocate, the thing that I hear the most from elected officials is that they didn't know there was a problem because nobody communicated that to them. You have to tell them. If it's great and there's perfect and you're having no problems, write that too. But please be writing your elected officials, even if you just want to give them an update on your day, whatever it is, you need to be writing your elected officials to let them know about the problems, because otherwise they think everything is hunky-dory and there's no changes that need to be made. Mm-hmm. So, I cannot say that enough. I know it takes time. I know it's annoying. Send an email, do whatever you need to do, but make it heard that you are having difficulty accessing care. Because without it, on the advocacy side, it is so much harder for us to get changes made when they don't know that there's a problem. So.
Absolutely. Well, thank you again. We have so much work still to do. But this is so important. I'm so glad that we're doing this series because, this is a very important time period. And as Americans are being torn apart by all of our perceived differences, it's so important that the military, that the veteran communities realize that we have more in common than we have different, and we need to stand together. Absolutely. No matter what.
Absolutely.
Right now, we need to fight for our benefits. We need to fight for our health care. We need to fight for our lives. This is about us. We are one. I don't care who you are. You're a veteran. You're my family.
Absolutely.
Let's do it together.
Absolutely.
Oh, thank you again. Until next time, join us at Living Chronic. That's a wrap for this episode of Living Chronic. I hope today's conversation gave you insight, inspiration, or at least a little reassurance that you're not alone on this journey. Living with a chronic illness or disability comes with its challenges, but it also comes with strength, resilience, and a community that understands. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who might need to hear it. You could follow me on Instagram at Chronically Brandy Shantz, other socials at Brandy Shantz, or my website at brandyshantz.com for more discussions, advocacy updates, and everyday strategies for thriving with a chronic illness. And if you have a topic you'd like to hear about, send me a message. I'd love to hear from you. Until next time, keep pushing forward, keep advocating for yourself, and remember, you are more than your diagnosis. You are powerful. You are unstoppable. Thanks for listening to Living Chronic. See you next time.